Hi, I'm Ed Furlong, and welcome to Digital Health on Air. I'm joined by Keith Fraidenburg, Executive Vice President and Chief Operating and Innovation Officer at CHIME. Today, we're talking about Keith's insights from a deep focus this year on understanding how health systems are approaching AI. Keith, welcome. We're lucky to have you today. You've been at CHIME for more than 25 years. Would you give us a little bit of your background and also give us some insight into how your time at CHIME has shaped your perspective on healthcare?
Absolutely, Ed. First of all, I want to thank you and the Luma Health team for reaching out and inviting me to share some of my perspectives really around AI and emerging technology. As you mentioned, I spent the better part of the last 9+ months this year spending a lot of time with CHIME members and health systems trying to understand what's really happening out in the field, particularly with AI. Let me just give you a little bit of my background. So my entire career of 30+ years has been in health IT, and a good portion of that, as you've mentioned, over a quarter century at CHIME. Now, listen, I'll be the first one to say it. I get asked this question all the time. How in the world does anybody stay at one company for over 25 years anymore? And I'll say, listen, nobody's more surprised by that than me. That was never really my intention when I started on my professional journey with this organization. But I think the answer really comes down to two things. And one, I think it's the team that we've assembled here, and I have the pleasure of working with and supporting every day. But more importantly, it's our CHIME members and our CHIME Foundation firms out there who are working so hard every day to make change happen and to ultimately improve outcomes and improve health and care in the communities that we serve, wherever they may be every day. I feel very strongly that our members and our foundation firms are the hardest working leaders and organizations in healthcare. I really do believe that. Having spent time in a CIO type seat before I came to CHIME, I know what it takes, and that job is harder than ever these days. But what I'll say about CHIME and the mission and the vision of serving exceptional leaders transforming health and care, it's an easy one to buy into, quite honestly, and it's one that you buy into for the long term. So that's a little bit about me in terms of my professional journey, but it's been a heck of a ride, 26+ years now serving the CHIME community and ecosystem. I can't imagine being anywhere else.
Yeah, it is. It is, less common these days. So I think that's a compliment to you and CHIME, frankly, the tenure, because with tenure comes, better perspective, I think, on things, especially in the role you play at CHIME, being able to, talk with the entire healthcare ecosystem. You really see what's going on. And while you were talking, I was just thinking, since today's topic's AI, I was thinking, given the length of tenure, probably one of the first things you focused on when you got there was Y2K. So we've come a long way from Y2K to AI.
I do remember Y2K. I remember being on call during, that evening, midnight, 1999. I don't miss those days. I'm glad we've reached a new level of technological prowess within healthcare. I think it's done nothing but a great deal of good. And listen, I know we're going to talk a little bit more about the promise and potential of AI. It's pretty exciting, actually. So I'm excited to jump into that. I've learned a lot in the last 9 months, spending time with dozens and dozens of health systems trying to understand what's really happening out there with AI.
Yeah, no, excited to dive in. And I know throughout the year, as you mentioned, you've been focused on meeting with health system leaders across the country to understand their perspectives on emerging technology, especially like AI. And certainly some of our Luma team staff have been lucky enough to attend some of those regional events you've been hosting. But, just curious, what prompted, the road shows you conducted this spring and summer, and how have those gone?
Yeah, thanks, Ed. It was an actual real pleasure to meet a couple of members of the Luma Health team in Nashville, which was the first of the road shows that I participated in. I think we did about 9 road shows between roughly February and August of this year. So, averaging about 1 to 2 per month. And why did we do this? I would say a couple of reasons. One, in my role at CHIME, it's absolutely imperative that I'm spending time with our members and our foundation firms and understanding what's on your minds. I think more importantly, what are the challenges, but also surveying the opportunities out there in the digital health landscape. There was no doubt heading late into 2023 and early into 2024 that AI was going to be a top issue, a top priority for our members. We'll talk AI and cybersecurity. I know we'll talk a little bit more about cybersecurity a little bit later. So it's really important that I'm out there spending time with our members and talking with them and trying to understand what's happening in their worlds, but also surveying the industry and trying to bring back those insights to our members. So that's really important. That insight helps us understand the types of content and programs and services that our team needs to be developing and providing back to the CHIME ecosystem to help them do their jobs a little bit better every day. I would say the second thing is I have a real listening ear when it comes to CHIME members. And I say CHIME members, but I also include our CHIME Foundation firms. And listen, you all asked us, CHIME, to go survey the field and find out what is really happening in this new world of AI. It's moving so fast, and it means something different for so many different organizations. Are there common themes out there? Are there some common use cases for an organization that hasn't started yet or is just getting started? Can CHIME go out there and try and sort some of this out for us and then bring back a little bit of a playbook? And in fact, we actually published an AI principles document a little later. Well, I guess it was in August, I think, of the summer. So that was a culmination of some of that effort over the past roughly 8-9 months.
Yeah, no, it's definitely, everyone should take a look at that report. And, you know, when you reflect on this, obviously we're all hearing a lot about AI in general right now, not just in healthcare, but it seems every day, email, seminars, everywhere. But it feels like, you know, it's obviously a topic everyone knows they should be paying attention to, but where would you really say, as you've dialogued with, you know, so much of the market here, the health system market, where would you say health systems are on the road to actually adopting AI into their workflows versus just starting to experiment?
Yeah, I'm going to use a phrase that I've used many times in my career, CHIME, and it goes something like this: if you've seen one hospital or health system, you've seen exactly one. And that's because every organization is so different. That it's no different from the perspective of adoption and or implementation of AI. Every health system is a little bit different. You know, you have to look at the culture of the healthcare organization, their appetite for taking on some risk depending on the level of AI adoption or implementation that they're looking for. You have to look at capital, right? These things don't happen. AI pilots don't run themselves. They require capital. They require resources. So you have to really take a step back and sort of survey the field. Yes, contextually, are there some common themes? Absolutely. And we'll talk about those. But I think at the end of the day, what's important in terms of AI is understanding that every single organization is different. And there's nothing wrong with that. Whether we're talking about AI or any other emerging technology, if you're blazing a path, great. We need trailblazers. If you haven't even started yet, that's okay too. And so I think some of the conversations out there, you know, CHIME members and other digital health leaders are looking for a little validation. Our organization's blazing a path. Is that okay? Are we being helpful? Yes. Are we leaving other organizations behind? Maybe today, but look, this is a long game, right? Healthcare is a long game. At the end of the day, trailblazers blaze path for everybody else. And so if you're out there blazing that path, I applaud you. I thank you. You're doing great work. You're going to help everybody who's coming behind you. And if you're just getting started or haven't really started yet, that's okay too, right? And there are some really great opportunities if organizations were just getting started or very nascent in their AI capabilities. There are a lot of great use cases out there that are very published today in tools that will help you get started and get going, demonstrate some impact and some ROI, and start to gain some confidence in your ability to leverage some of these tools, which, listen, at the end of the day, that's what we were coming together for over these past 9 months in these roadshows. You know, most of the applications, Ed, I would say that we're looking at are focused on Gen AI, right? And those specific applications tend to focus on achieving administrative or supply chain efficiency, driving rev cycle efficiencies. All of that is important stuff, right? It's maybe not rocket ship building, right? That's, I think, of innovations. A lot of people think innovation is building rocket ship. It may not be building a rocket ship with Gen AI if you're focused on, you know, improving rev cycle or administrative operations. But listen, we know there's a lot of waste in healthcare. And there's a lot of administrative and operational and supply chain waste. And so there's tremendous opportunity to wring out waste and save money, right? So that's an okay place to be if most organizations are there. Now, listen, you've got lots of research and academic organizations who are going far deeper than that, and lots of other healthcare organizations now trying to overgeneralize here. And what I mean by that is they're spending a lot more time with predictive analytics. They're building large language models. They're starting to move from, I said in January, February, March, we were talking about large language models. 6 months later, we're talking about small language models. I mean, this space is moving so fast. And again, that's great. The promise and potential of that kind of adoption and application of AI is beyond administrative efficiencies. We're talking about really improving health outcomes directly, right? Identifying patients at risk before they get sick. Keep them out of the hospital if we can. And from a diagnosis perspective, improving our ability to diagnose patients and then get them into more customized therapeutic programs, et cetera. That's the promising potential. And it's huge, right, on the other side of this. So there's a huge spectrum out there. And I think if there's anything that I learned, I go back to, if you've seen one healthcare organization leveraging AIs, you've seen exactly one. There's nothing wrong with that. Every organization is probably exactly where it needs to be based on their own organization, their culture, politics, funding, et cetera, in terms of what they're able to do today with AI. But I expect that to change rather rapidly over the next 1 to 2 years also.
Yeah, no question. Things are moving fast, and these models can improve rapidly, like literally every month, based on how you're evolving the prompts and the data that you're giving the models. Yeah. So it's interesting. It sort of makes sense. I mean, not any new technology has risks in deploying it, right? Because it's disruptive by nature. But it does make sense, that it's sort of less risky, if you will, focusing on rev cycle administrative tasks. It seems like you're seeing more rapid adoption into workflow and change in those areas. But as you get into more clinical aspects, there's obviously a higher risk because you're dealing with patient safety. So it makes sense that would be, something they'd go more slowly or more thoughtfully or carefully on. Do you see on the clinical applications, see that both on like the pop health management that you mentioned, but also are you seeing things in the acute care setting as well, or where do you see some of that work being done?
It's definitely both, right? So there are lots of examples of organizations working in both pop health and the acute care side and the ambulatory side as well. There are applications everywhere. To your point, when you start to get into areas of AI like predictive analytics, it gets more complex and it gets riskier, right? And the stakes are also higher. And immediately the conversation turns to issues around transparency and ethical considerations, the validity of both large language and small language models, privacy, security, regulatory requirements. Don't get me going on those, but we probably should talk a little bit about that. And then there's ultimately the issue of trust, right? Consumer trust in AI applications in healthcare, patients' trust, clinicians' trust in these applications at the bedside in some cases, right? Or outside the bedside if we're talking more acute care or ambulatory or pop health. But trust is the big issue. We had a conversation in one of our regional sessions where I asked the question, like, would you be comfortable? I asked first, would you be uncomfortable knowing that your primary care physician refuses to use AI in the practice, right? And I got a lot of hints, yes, that makes me uncomfortable. I think my primary care physician should be advanced and should be looking at using AI tools to be a better doctor and care for me and da-da-da. I said, okay, great. Would you feel more or less comfortable if you knew today that your primary care physician was actually using AI to make actual care decisions about, how you're taking care of? Oh, I feel less comfortable. Oh, wait a second. We all say that we think our primary care physician should be using AI, but then once I ask the question, well, if your primary care physician is using it, and you may know or not know, how do you feel then? Well, I feel very uncomfortable about that. So we've got a long way to go in terms of getting consumers and patients and even clinicians in some cases more comfortable with some of the bedside applications, if you will, of AI.
Yeah, no, for sure. So I'll throw a real curveball at you here, which is,
Oh,
when you've been out in the market, obviously there's a broad range of size and budgetary and, technical competence across health systems.
yeah.
I know some of the, major health systems and large academic medical centers, have been able to have budget, create resources, but a lot of health systems don't have that. And then meanwhile, you have independent venture-backed companies springing up, seeming like, certainly every month or so, there's something else going on. So, I guess how do you see this evolving in the industry? I know it's early, very difficult to say where it's going to go. Like, will standards emerge? Will the academic medical centers help set some of these standards for some of the other health systems? With some of these independent firms that are
Yeah.
being funded help set those standards? Any early thoughts on that? And again, I won't hold you to it because this is the very early days, obviously, in
No,
the
I, I,
industry.
I wish I could make some big proclamation today, and that I was very confident would hold true a year from now. But I'm not I'm not willing to risk that much. Here's what I will say though, and I touched on this a little bit. Those academic and research organizations are blazing paths today, and the path that they're trailblazing will be helpful to the rest of the industry somewhere down the line. And I don't mean 5 years down the line. We're talking a lot sooner than that, 1 to 2 years down the line. When I say I praise them, I thank them, I really do. Secondly, those organizations are attracting regulators and legislators, right? The work that they're doing is going to lead to the regulations, and they're coming. And if there's one caution that I would share with the entire industry right now is the regulations and the legislation have been slow to catch up to the pace of AI, but it's coming, and it's not going to be pretty. It's not going to be pretty at all, right? So, and I would actually suggest if you're an organization out there and you're piloting AI, particularly piloting around predictive analytics, you may have to start to prepare your organization to shut some of these pilots down based on some of the regulation that I believe will be coming down the pipeline. Is some of this a reaction to a technology that Congress and our legislators feel is moving too fast? Yes. Is it in reaction to a technology they don't understand well? Yes. Will we over time be able to dial in, I think, the appropriate regulations and legislation that will allow us to harness the potential of AI while providing responsible application and use of it? Yeah. But it's going to take a few years for us to get there.
Yeah.
But I am concerned at what is coming. I think it will, at least in the short term, portend to stymie innovation and the speed at which we're moving with AI today. Listen, that's what regulations and legislation tend to do. They slow things down. But I also believe that there probably is a need for some of this today. I think a lot of organizations are focused on the responsible and ethical adoption and application of AI. I would like to say that everybody is as focused on that, but I don't know that to be true. The other thing that I would share out there is rural healthcare is missing out. And if there's a part of the healthcare ecosystem that really needs to be able to leverage AI, even if it's just Gen AI right now, it's rural healthcare. What's the barrier? It's capital. It's capital and resources, right? Speak to any CIO CHIME member at a rural hospital, critical access hospital. They don't have the nurses that they need, right? To not have to send patients away to another, hospital 60 miles away on a day-to-day basis. You try and engage them on Gen AI, their eyes glaze over like, please, right? We're just trying to keep the doors open here. And also cyber's a real threat for us. And I wish I had all the resources I need just to protect my organization, but I don't have that either, right? So again, depending on who you're speaking with, it's sort of every organization is so very different, but particularly in rural healthcare, if there's a part of our ecosystem that could really benefit from AI tools, it's rural healthcare, and they simply don't have the capital and resources to take advantage of it. And I feel for them. I really do. There's a part of my heart that is very, very focused on rural healthcare. And so if there's an opportunity for us as an industry to come together and do some good, it's supporting rural healthcare right now, particularly with Gen AI, because I think it can help them.
Yeah, I think if some standards are set and tools are available, it might help them overcome some of their inherent
Yeah,
economic barriers that they're all dealing with. And back to your
absolutely.
regulation point, totally agree. Regulation, it can be a huge impetus for technology adoption, but also a barrier. And, so it'd be interesting to see how that plays here. You mentioned cybersecurity. Maybe you can touch on that in terms of, obviously it's been a
Mm,
big issue. It seems like it's
yeah,
growing in importance, but it converges a bit with the AI topic. So what are you hearing about cybersecurity
yeah.
out
The,
there?
the one thing I can say with a lot of confidence that is this year right now, there are two primary topics that are important to Chime members, and that's AI and cybersecurity. And I call them 1A and 1B. And depending on the time and the organization, the individual, the leader that you're speaking with, it may be cyber and then AI, it may be the other way around. But the cyber is not going away, right? So there's no doubt about that. I think there are some really interesting AI powered tools out there that show promise in helping healthcare organizations. Again, we just mentioned rural healthcare, in particular, rural healthcare. These tools can help them improve and strengthen their cyber posture through much better intrusion detection and response, malware detection, network security. Now, keep in mind, no tool is perfect, right? Whether it's AI or not AI enabled, at the end of the day, it's humans who tend to be the weakest point in any organization's line of defense when it comes to cyber. But there are some really interesting tools, AI generated tools that are coming to market that I think hold a lot of potential in terms of some of those things we talked about, intrusion detection, response, et cetera. The other thing that I'll share with you, and this sort of this enlightenment hit me at one of our regional roundups when I was speaking with a CISO who was on our panel. And I just said, it terrifies me that, at some point the bad actors are going to have their hands on these very same AI enabled tools. And she said, Keith, honey, they already do.
Yes. Yes.
I just put
Unfortunately, the bad actors tend to move very quickly on these things. Yes.
and they're better organized. Quite honestly, they're significantly better organized than we are as an industry, unfortunately. But again, reflecting on the promise and potential of AI, I do think some AI-enabled, AI-powered tools can be helpful to all healthcare organizations. But my hope is that we can start to put some of these tools at low cost, if not free, to rural healthcare who really needs it the most. They're the most vulnerable out there right now.
Yeah, so just this has been a great discussion, but just to sort of wrap it up here a little bit, Keith, if I were a CIO at maybe a smaller mid-sized health system and I haven't been invested, like what should I do on AI? Do you have resources at CHIME? Where should I go? How should I think about approaching the topic? What advice would you give me?
Yeah, thank you for the question. And one, CHIME did publish some AI principles earlier this summer. Those are available out on the website. You can search, use your favorite search tool to find those AI principles. If you're just getting started, it's a high level sort of playbook on how to get started. The second thing I would suggest is there are a lot of published use cases out there now for healthcare organizations, very specific to Gen AI tools, which tend to be free, if not low cost. These use cases will help you, demonstrate very quickly through pilot programs, return on investment. They're not change the world kind of stuff, right? But they're driving administrative efficiencies and operational efficiencies. Maybe they're improving revenue cycle. And there are lots of use cases out there. If you've got questions about where to find some of these resources, feel free to reach out to me, reach out to the CHIME organization. Be happy to help guide somebody. This is what I would say to any organization out there. Listen, if you're not at the forefront, it's okay, right? Not all of us can be trailblazers. We thank those who are, but you need to do what's best for your organization based on a multitude of factors. Capital and resources availability is one of those. Your organization's appetite for risk. What are the key priorities right now? If you're a CIO at a rural healthcare organization, AI is probably pretty far down on your list in terms of all of the competing priorities you have. I would say to support those who are blazing the paths out there for the rest of the industry. They're out there taking a lot of arrows, quite honestly, for the rest of us. And it's really the regulators and legislators who will be gunning for them, unfortunately. But such is the case. We're trailblazers, right? Somebody has to blaze the path for us in this new AI powered AI-enabled world, and I appreciate those who are doing that. But if you're not there, that's okay too.
Yeah, no, appreciate this, Keith. It's been a real pleasure to hear your point of view on this, especially given how much you've been out there in the market. I do think, like, CHIME plays a unique role in the industry, and particularly on such a new and potential technology with so much potential. I think we really could help the industry think it through and be a great resource. So glad you offered that up, and really appreciate you joining us today. And thank you for your insights.
Thanks, Ed. It's been an absolute pleasure joining you and sharing some of what I've learned in the last several months here, speaking with CHIME members and health systems. The only thing that I know to be true within the next 3 months, we'll be talking about different facets of AI already. Moving that fast.
Okay. Thank you, Keith. Have a nice day.
Very much, Ed. Yep, you too.
Take care.
Take care.
Bye.